Welcome back to the Bigger Than Birth podcast, where we're celebrating bigger bodies and beautiful births. I'm your host, Victoria Gaba, and each week we will be bringing you the real stories of plus-size moms as they share their journey through fertility, pregnancy, birth, and postpartum. These stories highlight what it's like to navigate through this experience as a woman in a bigger body in hopes of creating representation for plus-size moms, both present and future. Thank you for being part of this community as we share these stories that are so much bigger than birth. Hi everyone, welcome to today's show. Today we're sitting down with Carly, whose path to motherhood was anything but simple. After years of navigating PCOS, an undiagnosed thyroid condition, and doctors who handed her a weight loss pill instead of real answers, Carly found a provider who looked past her size and treated the actual problem. Carly's story is truly one of resilience as she takes us through the heartbreak of an early miscarriage, a twin pregnancy complicated by her life-threatening parathyroid tumor, and the absolutely devastating loss of her twin girls, Ember and Estelle, after they were born at only 21 weeks. After taking a break on their fertility journey to heal and recover from the loss, Carly shares her next steps as she fought her insurance company for months to access IVF coverage, endured another early pregnancy loss, and finally, with the help of IVF and a successful transfer, she was able to welcome her son Granger on Christmas Eve. Carly admits that she is always one for the dramatics, and her induction was no different. After the doctor manually broke her water, her son had a cord prolapse, leading them to a stat C-section under general anesthesia. Carly walks us through their postpartum experience, being so thankful that her and her baby were okay, as well as gives resources and advice on anyone who is or knows anybody experiencing pregnancy loss. Before we continue on, I definitely want to give a trigger warning and gently prepare you for what's ahead. Today's episode includes an honest discussion of miscarriage and late-term loss as we discuss Carly losing her twin girls. If this is a tender subject for you right now, please take care of yourself mentally as you listen. Pause if you need to, or skip this episode and come back at a later date. If you've experienced pregnancy loss in the past, or if it's something that you're navigating right now, please know that you are absolutely not alone. We've left a couple resources in the show notes below, but if you need any more or you just need a listening ear, please reach out to us. Now, without further ado, let's jump into Carly's story. Hey, Carly, thank you so much for coming on the podcast today.
Thanks for having me.
Well, we are super excited to have your story. I know you have quite the journey that you're going to share with us, but I guess we will start by just having you introduce yourself and your family and where y'all are from.
So we are from Nebraska. We're in Omaha. It's me, my husband, Grant, and we've got a baby Earthside. His name's Granger, and then we have a couple angels up there.
Very cool. And how old is Granger?
Granger just turned 16 months.
Oh my goodness. So cute. Well, awesome. Like you said, I know you are going to talk a little bit about your babies that aren't Earthside. So with your first, were y'all trying to conceive when you did?
Yeah, so I have PCOS, and I knew that before we got married. So Grant kind of knew what he was in for. We got married in 2019, right before COVID hit. So we started our infertility journey during COVID, which was kind of a wild ride. In Omaha, there's two clinics to go to. And the first clinic, Maud, they call her Maud the God. And I went to go to her clinic, but even her consultation wasn't covered by insurance. She was out of network. So even like when you go through infertility, they try to code some things to go through insurance just to save you a little bit in the beginning, but nothing would have been covered. So we ended up having a consultation with the other clinic, which is where our journey kind of started, but my consultation ended in kind of heartbreak. I had PCOS. Well, I still have PCOS, and they basically gave me a weight loss pill and told me to lose 100 pounds and call them when I was at my goal weight.
Oh my gosh.
And so that went nowhere, and it was just super heartbreaking. And they did some blood work. We never got the results of it, and just kind of resolved to, well, I needed to lose some weight because they told me I'd never get pregnant at the weight I was at. And so time passed and new insurance came around, and Maud was in network. That didn't mean anything was covered. That just meant we could see her and it wouldn't cost $500 to have a conversation with her. So I went to see her, and this was in 2020 still. And she ended up getting the blood work from the previous clinic. And we talked about my weight. And she said, I'm not worried about your weight. You have PCOS. That's your problem. And she said, but are you aware you have a thyroid problem? I said, I was not aware I have a thyroid problem. That is news to me. She said, well, we'll address your thyroid problem because your thyroid level's also going to prevent you from getting pregnant. Okay. So we did thyroid medication for a little bit until that evened out. And then we did our first IUI in 2021. We got pregnant on our first IUI, and unfortunately, I miscarried on Christmas Eve. So that was heartbreaking. But we dove right back into another IUI and got pregnant again. And we conceived our twins, Ember and Estelle. But something wasn't quite right with me. Didn't know what it was. I was having a really hard time. And oftentimes people are dismissive when you have twin pregnancies because you're extra tired. It takes more energy. I hadn't gained any weight, so they weren't worried about that. And I was just forgetting things. And it was super odd, super off. And I kept telling the doctor, I don't feel right. I don't feel right. And this was my high risk doctor because I was pregnant with twins. And they noticed my cervix was shortening. And they just kept monitoring it. And they ended up doing an emergency cerclage to try and save the pregnancy.
And for those who aren't familiar with what a cerclage is, do you want to explain that a little bit?
Yeah, they go in and they stitch your cervix closed. It doesn't prevent it from dilating further, but it's supposed to help strengthen that and help delay that process. So they did that, but my cervix kept shortening and they didn't know why. And then eventually that led to being admitted to the hospital. And that was a terrifying moment. I didn't know what was going on. They didn't know what was wrong or why it was happening. And they just kept doing blood work. Well, they found out my calcium was at like a 16, and they had no idea why. And they kept doing more tests and more tests. And I remember the doctor coming in and saying, I'm not quite sure how you're awake right now because most people in your condition are in a coma
Oh my gosh.
because my calcium was so dangerously high.
Yeah.
And they ended up doing an ultrasound of my throat, and I had a huge tumor on my parathyroid, which isn't your thyroid, it's your other thyroid gland that sits behind it, I believe. And you have 4 of them, just like your thyroid. But I had a huge tumor on it. And nobody knew how sick I was. Nobody had any idea up until right then how sick I was.
And had you had any other symptoms besides just being extremely tired, and that was just, like you said, chalked up to being pregnant?
The confusion. And later down the road, I said to my mom, I said, I probably should have known something was wrong when I didn't remember driving home.
Oh, wow. Yeah.
And she was like, yeah, that was probably a red flag. And I was like, but everybody just said I was pregnant with twins. It was fine.
And how far along were you at that point?
I was, when they discovered the problem, I was right around 20 weeks. So about halfway through. And they really didn't know what they were going to do. I was at the women's hospital, which specializes in women's health, and pregnancies and birth is the main thing that they do. And so they don't do parathyroid removal there. And they ended up moving an entire surgical team from the main hospital on the other side of town to the women's hospital. And, like, I can't imagine how many surgeries and everything that got rearranged because they had to bring an entire surgical team and their equipment out to the women's hospital. Um, but that was in the morning that they discussed doing that, and then they were just like, "We're gonna keep you on bed rest, we're gonna do this surgery," like, because obviously having surgery at 20 weeks along is not ideal, but otherwise it was gonna be my life. And so it was a risk that we were going to have to take, not realizing that later that night I was going to go into labor with the girls and deliver the girls at just at, I think, 21 weeks and a few days. Um, they both came out breathing and crying, which was a miracle. Um, all of the sudden, 50 people were in our room, um, and they immediately went to the NICU. Um, And then the next morning, I had the emergency surgery to remove my parathyroid and the tumor. Um, I was in the hospital, I think 4 days. I don't remember a lot, unfortunately, from that time period because of all of the 1, trauma, and 2, I was so confused from everything, all my health problems. Um, so the girls survived about a week in the NICU, which was a miracle in and of itself, before they both passed. Um, and that was really hard,
Yeah.
because we had fought so hard for them.
No, I think that is such a whirlwind of an experience with your own health, but then you're concerned with their health as well. And so, did they give you kind of any indication of what going into labor at 20 weeks would even look like, or possibilities, or it was all happened so fast?
It all happened so fast. I remember talking to the neonatal ICU doctor, and he told us, like, they give you all of the, like, risks and all of the statistics and all of that, and it was just so overwhelming. You don't know what the right decision is, but at that time, we felt we fought so hard for them to be here. We should give them a fighting chance to be here on the outside, um, and it's still a hard decision. You know, we had to make the decision to take our children off life support, and that's a choice we have to live with for the rest of our lives, and I don't regret it. I don't regret it at all because at that point, they were uncomfortable. They were not well. Um, so that's kind of where our fertility journey took a hard stop for a while because it was scary, and I had my own health to worry about.
And so, how was your healing after that? Like, obviously you have a lot of physical healing, but then the trauma and the loss on the mental healing side. Talk us through what that looked like for you.
A lot of therapy, a lot of therapy. Um, we're fortunate enough in Omaha to have a support group locally that deals with infant, child, and pregnancy loss. So that has been a rock for a long time for me. Um, I've met some wonderful people through it, and it really helped carry me through that. I had also lost my job shortly before I gave birth to the twins, so it was kind of nice to not have to go to work because it was a healing journey. I had a lot to heal from physically, emotionally, all of it. So yeah, that's where our we kind of hit a pause. And then I got a new job. That was so the girls passed away in August. I got a new job in October. So there was a period of unemployment that was kind of hard. And at that point, I got a job that had fertility coverage, but we weren't ready yet. We weren't ready to take that plunge yet. And we had had the conversation with Maud, and she had said, you know, with the PCOS and your chances of twins are higher now that you've had twins. I don't want you to take that risk. So your only option with me is IVF, which is a big pill to swallow, a big, giant financial pill. So we weren't mentally ready to pursue IVF. It took a while to get there. And then finally in March, I contacted our insurance company because you have to activate the fertility portion of your insurance. So I did so, and they let me know that Maud was not a preferred provider. And unfortunately, the only provider I could go to was the original provider that I met with back in 2020. And that was not an option for me. I was not willing to accept somebody that just said, "Here's a weight loss pill. Call us when you lose weight."
Right, and no support at all
No
other than
support
just
at all.
sorry.
Yeah.
Yeah.
I've educated myself so much on having PCOS, like myself, because so many providers are not educated in it. And it's really sad because it affects so many people.
Yep, absolutely.
And so I told my mom, I was like, you know what? I'm not going to accept that this is my only option. And I called the insurance company and I was like, listen, I have established care with another doctor. And that's who I want to see. And they're like, okay, well, you'll have to file an appeal. Okay, I'll file an appeal. So in July, I think we filed our appeal to see Maud over the other provider. And my appeal was denied.
Of course.
But it wasn't denied because they didn't want me to see that provider. It was denied because they said I wasn't enrolled in the fertility program. But I was enrolled in the fertility program. I enrolled in March. And I knew I was enrolled because I was on a St. Patrick's Day party bus when I enrolled. I was like, I know exactly what I was doing when I took that phone call from that nurse. I know what I was doing.
Oh my gosh.
And I just kept going rounds and rounds and rounds with them. And so we started in July and they just kept denying the appeal because I wasn't enrolled in the fertility program. And then it got to the point where they stopped returning my phone calls.
The insurance company.
Yeah, the insurance company stopped returning my phone calls. And I was like, this is not okay. It's not okay. And I was emailing anybody I could get a hold of. And unfortunately, my workplace was not very helpful, mostly because they didn't know what to do.
Yeah.
They were like, we've never dealt with this before." Like, I was probably one of the first people to use the fertility benefit to begin with, and here I am trying to fight it.
Right, and if you're offering it as a benefit, at least be educated on it enough to be able to assist people.
It was so hard, and I just kept calling. I just kept calling. I would call any number to that health insurance company I could find and demand to speak with somebody and email people, and I had a whole notebook full of notes, everything. So I fought them, and, they have every right to deny me. I'm trying to get service that they don't provide. They have every right to deny me, but you're not gonna deny me because I'm not enrolled in the fertility program. That's what you're not gonna do. That's what you're not gonna do. So from July to the end of October, I fought the insurance
Oh my
company.
gosh.
And finally, I got a hold of the right person in the right place. And she's like, you know what? This isn't right. I was like, I know, been telling people for months. And within 72 hours, she had it approved and pushed through,
Oh my gosh, that's
which is
amazing.
so wild. Like, it
It's
shouldn't.
wild that you have to do that in the first place. Like, you shouldn't have to fight that hard to have coverage at all, but the fact that you had the coverage and then they were saying you didn't, like, come on.
Well, and it really makes me wonder, like, how many women were in the same place I was and they just said, okay, I understand, and like
Right?
walked away from that fight because it was a full time job.
Yeah.
Like, I'd call on my lunch break. I'd call after work. I'd call on my way to work. Like, I was calling them 3 or 4 times a day,
Oh my gosh.
5 days a
Yeah,
week.
and isn't that crazy that, like, that's what you had to do? And like you said, so many women would be discouraged, like, way
Right.
earlier on, but you're like, "No, we're making this happen."
You're already going through this infertility fight, and then you also have to fight this? It's ridiculous. So we fought, we won, we got the coverage, had to pay for another year of it. It's fine.
Right? Because you would, like, miss the cutoff on your deductible or
Yes.
whatever
Well,
anyways.
because the way it would have lined up is it got approved in October. There's no way I could do a retrieval and a transfer by December. There was no way. So we started our retrieval process, which was terrifying and hormonal and scary. We ended up getting like 27 eggs,
Oh, wow.
which is an insane number, but I also have PCOS. So that's most people don't know that that's typical for somebody with PCOS is to have a lot of eggs. It doesn't necessarily translate to a lot of embryos or anything like that. So we had 27 eggs and I had to write it down. We had 27 eggs, 15 were mature enough, 10 fertilized, 7 made it to blast. Of the 7, 4 were genetically normal. So that 27 ended up being 4.
How was that process? I know it's literally just, like, step by step, but seeing that number kind of go down, talk us through the mental side of that. What was that like for you?
Terrifying. Like you see the stories like, "Oh, we ended up with no embryos. We ended up with 1 embryo." Like, you know that, like, your retrieval number really means nothing. And it just kind of it wrecks you because 'cause you're like, 1 but like, chunk by chunk by chunk. The attrition is terrible, and there's nothing anybody can do about it. And I don't have a lot of friends that went through the IVF process, so it was very new to me. But the way I best explained it to people, if you think about it, we got 27 eggs. So that's 27 months of trying. If you think about you get 1 egg a month. So of those 27 months, almost 2.5 years, 15 of those months was the egg good enough to mature. And of those 15 months, 10 times it fertilized. And 7 times it was big enough to implant. And only 4 times was it genetically normal enough to become a baby.
Which honestly, I think that is such a great perspective to put it because, like you said, for trying that long, people usually don't get pregnant on month 1 or month
Right.
2, so it does take longer, and then people do go through loss or something with genetic abnormalities, and so it's literally just a condensed time period and such a, like, one go, here we go, all of the
Yeah.
eggs.
We took 2.5 years and smushed it into 1
Yeah,
month of
that's
data.
such a great, like, mental way of thinking about it.
Well, and, like, I explain it to people that also, like, have trouble conceiving and, like, they're like, "Well, we've been trying for 3 months." Let's let's do some math. Like, this is how it really works because it doesn't work how they explained it to us in school or how our parents explained it to us. Like, it especially for everyone, it doesn't work that way for everybody.
Yeah,
And
and then you
so,
add
like
in PCOS or irregular cycles, and then that's a whole different
right,
ball
you're
game.
talking about having 27 cycles in 2.5 years. Not everybody has 27 cycles
Right.
in 2 years. When I was younger, I was lucky to have 5 or 6 cycles
Yep.
in 2 years. Like, it was very real. And so that's how I explained it to my friends, like, because they have no idea. And my friends are wonderful, they're supportive, but they have no idea what's going on.
Yep. They just support you from the sideline.
Even my poor husband, who was raised in a small town, went to Catholic school his whole life, I was like, "Sir, let me tell you about the education you're about to receive on how the women's bodies work." He was not prepared.
Yep, and I'm sure he learned more than he ever thought he
Oh,
would.
more than he ever wanted to know.
Yep.
So we had all of that taken care of. And then we did our first transfer, and I got pregnant the first transfer. Um, but we went for our 8-week ultrasound, and there was no heartbeat. We had lost another baby. So we had 3 pregnancies and lost 4 babies, which is a lot. It's a
Yeah,
lot of loss. But we were gung ho about it, and we did a transfer right after that, and that's our Granger.
that's amazing.
And
How long so after that loss, is there a recommended time period before you start another IVF cycle, or what does that look like?
it's really dependent on your body. Like if your blood work is normal, if your lining is normal, if all of that is normal, the doctor will tell you go ahead. After that, it's mentally, are you ready? And I was just so ready to get, for lack of a better term, a prize out of this race. Like I was ready. And so we got the go ahead almost right away. So we transferred in February, found out we miscarried in March, transferred Granger's embryo at the end of April. So it was very retrieval January, transfer February, miscarriage March, transfer April. And every ultrasound, every blood work after finding out that positive test was holding my breath every single time. It's terrifying. It's absolutely terrifying. And I was fortunate that my reproductive endocrinologist never questioned my weight. My OB never questioned my weight. Even my PCP doesn't question my weight. I've had the same PCP since I was born,
Wow.
and I've seen his nurse practitioner since I was 8. So they're wonderful people. I'm very lucky that in that medical space, I don't experience discrimination because of my weight. They've been nothing but supportive. It's the outside people that are a problem. Um, but so I got pregnant with Granger, went through the 12 weeks at a fertility clinic. That's normal until you graduate. I did get sent to maternal fetal medicine, so high risk. And part of it was my weight, but the other part of it was I had experienced so much loss. And I had experienced a late term loss with the complication of a shortened cervix. So automatic, there was no question about it. I was going I was going to high risk. Um, and the doctor I picked out, I have a nurse friend, and I was like, who would you pick? And she told me his name is Todd Lovegren. If you're in the Omaha area, he's a fantastic high risk doctor. He's experienced loss himself. So that was a big check mark. Like he understood, at least from the male's perspective, the anxiety of a loss. Um, and he never mentioned my weight, never brought it up. And I actually didn't gain any weight with Granger until the very end. And I didn't gain that much, and I lost it almost immediately after birth. So that was wonderful. But he was fantastically supportive. In July, I said, I'm real freaked out by my cervix. And he was like, do you want to do a cerclage? I don't think you need one, but if it'll make you feel better, we'll do it. So we went in and we did a cerclage for no other reason than I had anxiety and it was going to make me feel better.
Yeah, just the peace of mind.
Yeah, just the peace of mind to already have that in there. And every appointment, they checked my cervix length, every single appointment. And I think we got to like October, and he was like, okay, I think we can go to once a month. And I was like, or we could just keep coming every other week because that's what works for me.
So once you graduated the fertility clinic, you started seeing MFM every other week?
Yeah, I saw MFM every other week, which really got me through my pregnancy. I needed I needed to see the little baby on the screen. I needed that ultrasound for my own sanity, and I was lucky enough to have a provider that understood that completely. I was like, I hold my breath up until this appointment, and it holds me through for about a week, and then I hold my breath for another week, and then we get here, and we're good for another
We just
week.
do that loop over
Yep,
and
we just
over.
do that loop over and over again.
So, with seeing the MFM doctor and then also your past situation with your thyroid and the tumor or the parathyroid and the tumor, was there anything as far as tests that they were looking for monitoring with that? Or once you had that surgery, everything kind of leveled out?
So it did kind of level out after that. I was on medicine for my thyroid because my thyroid was still not reliable. But that was managed by a separate doctor, uh, an endocrinologist who doesn't just do diabetes, they do your thyroid and hormones as well. So he monitored that and made sure my levels were stable. And they continued to monitor my calcium because now that I don't have a parathyroid, I'm actually more at risk for low calcium. So for like 6 months after I got my uh, parathyroid taken out, I carried around a bottle of Tums, and not because I had heartburn, but because my calcium would dip and I would feel sick again. The same exact symptoms as it being too high, I was too low, and I'd have to sit and eat Tums.
Better Tums than just carrying around like a gallon of milk with you.
Yes. Yes. And, like, even till this day, I'm so, like, paranoid about it. I keep a stash of Tums in my desk at work. There's Tums in our house, like, there's Tums everywhere.
At least you knew you were not getting heartburn through that pregnancy. You
No,
were
no,
ready.
I was ready. I had Tums everywhere. Um, it was a running joke at work. "Oh, you need Tums? Carly's got plenty of
Like, what
Tums."
flavor do you want?
So that's really it. They monitored my calcium throughout the pregnancy, and they kept an eye on my thyroid, and I stayed on my thyroid meds. Granger was a relatively uneventful pregnancy. I did have gestational diabetes, which is nothing to do with us and everything to do with your partner.
You're like, "Thank you for that. I've been through enough. Please, I didn't need this."
Thanks. Um, but I was able that was diet controlled. Up until the very end, I did have to be on insulin for just a little bit. We did have a scare where I thought I was going into labor, and luckily, unfortunately, both of which, the maternal fetal medicine specialists at my hospital know me all too well. And when I showed up at the hospital that day, I was welcomed with open arms. And they're like, well, if you feel like you need to be here to get checked out, you're here to get checked out. So I can't say enough good things about that team. I had a 360 view from when I first started my infertility journey to the end. And those people that told me I'd never get pregnant at my weight, well, I proved you otherwise.
Right.
And none of my losses had anything to do with my weight. Nothing to do with my weight. And so that's just kind of a thorn in my side. Like,
Yeah,
see?
absolutely, and I'm super thankful that you did get in with a good team because I can't imagine going through the loss that you've gone through and someone even making an offhanded comment of, like, "It's your fault," or something along those lines, like, because if it sounds like that clinic, like, that might be something that would've come out of somebody's mouth,
Oh,
and to,
I
like,
think
to
yeah.
fuel that fire of the loss that's going on, like you said, it's nothing that your body or that your weight did, it just is unfortunately something that happened.
Well, and you would never make those comments, and I have had those comments, not from anybody close to me, but from outsiders. And you would never tell a woman of a quote unquote healthy weight who's experienced the same things I have, you wouldn't tell her those things. You wouldn't tell her those things, you wouldn't say those things. You would just feel bad for her loss and move on. And so that's what's upsetting. That's what gets me is like, oh, you're only saying that because I'm plus size. You wouldn't say that if I wasn't.
Yeah,
Uh,
absolutely. But thankful, like you said, you got at the end of it a whole a whole opposite
yes,
experience where the people
yes.
were amazing. So talk us through when you did think you were going into labor. Was that actual labor or what happened?
No, I just felt weird and I'm super paranoid. We were that would have been November. So we were past the 28-week mark. So we were considered safe. Your chance of having a baby and surviving were much higher at that point. So there was lower risks. They did still give me the steroid shots to develop the baby's lungs in case anything happened. Um, my nurse friend got to give me the shot. She was all too excited about it, let me tell you. I have cupcake tattoos on my hips. And she was like, "Can I give it to you in your cupcake?" And I was like, "I guess if that's really what you want to do, go for it.
Yes, go for it, friend.
If that'll make your nurse heart happy, you go for it." Um, and and having nurse friends, let me tell you, is the best thing in the world. Side story, she was a nurse. She's at that same hospital, and the day I lost the girl, she was the first person to hug me. She's like, "Do you need a hug?" And I was like, "Yes. Yes, I need a hug." She came into my hospital room in the middle of the night and just, checked on me for no reason. So that was a special connection that I had there that really got me through a lot. But yeah, she got to give me that steroid shot and she was way too excited about it. Uh, but I was in the hospital for a couple of days because those shots mess with your gestational diabetes because they're steroids. And so they wanted to keep an eye on my blood sugars. And so I got to hang out in the hospital for a couple of days. And then I got to go home. And the rest of the pregnancy was relatively uneventful. We didn't have any issues. I did at the very end, we were getting induced the day after Christmas was our planned induction date because Granger was a large baby, not only due to genetics. I have a tall husband, he has tall family, I have tall family. We were kind of genetically disposed to have a large child. And so they knew he was going to be large. And because of everything else I've been through, they were like, let's just get you in at 37 weeks. We won't risk you going into labor on your own and the right staff not being here. Let's do it a controlled environment. But I went for my last appointment on Christmas Eve and my blood sugar was just a little too high. And they said, "You've been through too much. We're not going to mess with it. You're going over to labor and delivery." And I was like, "Oh, okay, we're having a baby today. That's the plan now." That's the plan now. Um, so we went over to labor and delivery and started the induction process. They removed my cerclage, which is not fun. Basically, like cutting stitches, but it's in your cervix and it's not fun. From that point forward, it was relatively, again, uneventful. And then I had the unfortunate experience of experiencing a doctor that was not part of my team. And they were having trouble monitoring Granger because he kept moving and they wanted to keep track of his heart rate. And of course, I was on a mag drip, which mag drips are not fun. You're basically glued to the bed. You're tired, you're exhausted.
And was that due to high blood pressure?
Yeah, due to high blood pressure, they were just being very conservative about all of my care, which I love, respect, adore, but it wasn't any fun.
Yeah.
It wasn't my picture of labor. It wasn't my birth plan to be on a mag drip. I don't think it's anybody's birth plan to be on a mag drip. And she came in and they were going to place an internal monitor, which I was fine with, like, do what you gotta do to monitor my baby. And she was checking me and she was like, "Oh, I think I can break your bag of water. Are you okay with that?" And in retrospect, I should have said no because I wasn't ready. I was only like 3 centimeters dilated, not very far along. We had only been in the induction process for, I think, 8 hours at that point, which is not long at all. And she broke my bag, and Granger floated up, and his cord came down, and his cord prolapsed because he came back down on his cord. I had planned on as natural of a labor as I could, so I had not had a epidural, and so I had to go to the OR immediately because the only way out, she couldn't get him pushed back up off of his cord. So I got to ride to the OR with somebody's hand pushing him up off of his cord, holding him there while I was screaming. And I asked my mom later, "Do you think everybody heard me cursing all the way to the OR?" And she goes, "You did what?" And I was like, "What do you expect?"
Yeah, it's not the first time they've heard yelling, but that is a situation where it's absolutely okay and warranted.
Like, Mom, you already know I have the mouth of a sailor. What did you expect? And from what I remember, they basically threw scrubs at my husband and told him to put them on. And we went to the OR and they dumped betadine on me. And I remember what made me upset is the doctor that had broken my water, she kept arguing with the other staff about calling the high risk doctor and telling them that they needed to be there right now. And he's like, "Well, I'm on my way. Like, I'm on my way." Yeah. And she just kept yelling at people. And then I remember the anesthesiologist, because I didn't have an epidural, they had to put me under general anesthesia. And when they do that for a C-section, they wait until the last possible minute to put you under, because basically once you're under, they immediately start the C-section because it does cross the placenta. So they want to get baby out as fast as possible. So I remember him standing over me with the mask, waiting for the go ahead. And then next thing you know, I wake up in recovery. Um, yeah, it was a traumatic experience to say the least. Um, my husband unfortunately did not get to be in the room for him to be born. He did get to cut the cord, but he was already out by the time they let him in the OR. And one big thing that like therapy I've discussed in therapy is so many people got to meet my son before I did, because it was probably 2 hours before I woke up after he was born. So many people got to meet him before I did, and that was not part of the plan.
Yeah.
And so that's been a hard pill to swallow. That's been a hard pill to swallow.
Yeah,
Yeah.
absolutely. And I think, like you said, the word trauma, I know a lot of people now just kind of throw that around, but I feel like this is a big T, like trauma,
Yeah.
and like this is warranted. And I think, I mean, at that point, you probably didn't even have a moment to actually rationalize because it was all moving so fast again. Did that kind of send you back to the last time and the anxiety when the last medical procedure had to move super fast? And how was that kind of coming to grips with that mentally?
It was more terrifying that I didn't know what was going on. And
Mhm.
like the fact I knew I was going, I mean, Granger's life was in danger, like real serious danger. And I've already buried 2 babies. I've already done that. I didn't want to do it again. And like knowing that they were going to put me under and I wouldn't know the outcome for hours. And you don't remember when you're in under general, but it was still terrifying. They were going to put me out and I wouldn't know for hours what happened to my baby.
Yeah.
And I do remember waking up in recovery, and the first thing I asked is, "How's my baby?" And the nurse was right there, and she said, "He's big, he's beautiful, and he's fine."
Oh, that's so good.
and then I went back to sleep.
But the fact that you remember that and she was there to reassure you of that,
Mhm.
was that nurse part of the team that you knew, or that was just a random recovery
Nope,
nurse?
just a random recovery nurse, but it's like she knew I needed that information, and she had it. He's big, he's beautiful, and he's fine. And he was big, almost 9 pounds at 36 and 6.
Wow. Yeah.
He was 9 pounds, 21.5 inches long.
That is indeed a large baby.
Yes, he was a large baby, um, and he was fine. He's fine, he's fine, and I was tired from the mag drip and everything that had happened, and I think it was another, like, 45 minutes before I went upstairs. It was Christmas morning by the time I went upstairs.
So was he born on Christmas Eve or Christmas Day?
Christmas Eve.
Oh my
He's our little
goodness.
Christmas Eve baby.
Yeah.
His grandparents, his grandpa on my husband's side is a Christmas Day baby. So he almost had a birthday buddy, but he got Christmas Eve. So, yeah, he's our little Christmas present.
That's so special. So,
Yeah.
once you were up in recovery, did they tell you, like, your husband is with the baby, or were you just still kind of out of it at that point?
They did tell me that baby was in the nursery, dad's with him, um, and they'll meet you in the room basically. And by the time I got to the room, they were both in the room waiting for me. My mom was there, his parents were there. So yeah, it was good to be all together. I did still have to go through the mag drip and I had a C-section, so that was added recovery that we were not prepared for.
So, obviously, with everything going on, I know it is probably a daze, but talk us through the moment when you actually got to see him and hold him for the first time.
I didn't wanna put it down. Like, it was not real. Like, we started our infertility journey in 2019, and we had a baby in 2024, almost 2025. So, not the longest journey by any means, but certainly not the shortest, and we had done a lot of fighting in between, so I remember saying to my mom, "Is he real? Is he real?" She's like, "Yes, he's real." I was like, "This is the best Christmas present ever." I remember for years, my mom would ask me what I wanted for Christmas or what I wanted for my birthday. I want a baby. I want a baby. And I finally got my baby for Christmas, literally for Christmas.
Oh, you're gonna make me cry. That is so, like, it is so special in the fact that, like, you went through so much, but you didn't give up that fight, and I know probably a lot of people along that way would've, but you fought, and then, like you said, that's the best absolute present you could ever get.
He's my perfect little Christmas present. And he's so special and he's such a happy guy. And we're so lucky to have him. It's incredible. Yep.
Yeah, for sure. So talk us through those early days since they did have you on the magnesium drip. Did they end up keeping you at the hospital a bit longer, or what was that immediate postpartum like?
We didn't obviously go home until after Christmas. I don't remember how many days we stayed in the hospital. Not anything extra. We didn't stay any extra. Um, but they were still very much on the get you out as soon as possible. I think that's their new thing is get you out as soon as possible because they don't want anybody getting sick. Um, but they did a wound vac, which I'm very thankful for. I have an apron belly, so I can't imagine how it would have been without a wound vac. It made my recovery so much easier. Um, but the mag drip really knocks you out and really makes it recovery really hard. And it makes it really hard to bounce back and like be prepared to be a mom. Um, but I'm very fortunate to have a very secure support system. Um, I do remember Christmas Day. Dr. Lovegren unfortunately missed the birth, but he came and saw me on Christmas morning.
That's so nice. That's
And it's
dedication.
Oh, yeah,
Yeah.
he's a wonderful human being. Um, it's a running joke that I'm always key for the traumatics. Even when we went back to our fertility doctor, the nurse said, "You always do everything so dramatically." And I was like, "I can't help it. It's just who I am. It's gotta be dramatic. It's gotta be dramatic. It's gotta come with a story. I can't help it. It's just the way I am."
Yeah, I mean, and that is quite the story, so they were correct.
They were very correct. I do everything dramatically.
So once y'all got home, how was that recovery afterwards? I know you said the wound vac helped. Was it pretty smooth? And then it was just the mental catching up to, oh my gosh, what the
Yeah.
heck just happened?
Yeah, oh my gosh. Okay, so we have a baby now. He's here. He's real. Like we made it like we had gone through the process of walking out of the hospital without a baby. And even like leaving the hospital, my husband was like, "We've never left with a baby before. Like, this is a whole different like ball game. Like we've never left with a baby before." I said, "Yeah, but they gave him to us and we're going home with him. That's what's
I
happening."
think he's ours.
I think he's ours now. And it's like kind of this surreal feeling like, wait, I get to take him home? Like, and we were lucky even because at 37 weeks, you still run the risk of lung issues, especially with a C-section because they don't go through the birth canal. Um, but he didn't have any issues. He was a little jaundice. Um, and of course, he was born on a very gloomy week, so we couldn't just put him in the sun. So we had to do some checks for that. But other than that, they were just kind of like, "Here's a baby." And I was like, "Oh, this is how this works."
Yeah, this is what I've been fighting for, but I wasn't prepared for this part.
No, like even after almost 5 years of fighting for it, you're just like, "Wait a minute. I wasn't ready for this. Just kidding. Just kidding.
It was all in the lead up, and you're like, okay, he's here now. What?
Now what do I do?" And like I even said to my mom, I was like, "Okay, now what? Like, what do I do?" And she's like, "You're a mom now. That's your job now. You're a mom."
Did you have a plan as far as feeding goes? Did you want to try breastfeeding, or how did that go?
So, I have some sensory issues. So breastfeeding was never really part of my plan, but I really wanted to pump. And I was very successful in pumping for the girls. I got too much milk for the girls. I was an oversupplier for the girls, even with twins. And NICU babies, they don't drink a lot, but I had a freezer full at the NICU. And between C-section recovery and the mag drip, like pumping is just really, really hard. Um, I'm not a huge fan of pushing breastfeeding on people. Um, I'm a firm believer in fed is best. Um, and I tried really hard to pump, but my supply just it wasn't coming in and it didn't come in. And I tried for a month and a half and just I couldn't get enough to feed him. So we did end up on formula, which is what it is. And, sometimes when things like that are taken away from you, it's a little hard because you want that. And I wanted to be able to feed my baby, and I wasn't able to do it. But I'm a firm believer in I'm here, I'm alive, he is here, we are alive, and we are just going to go with that. And
Yeah.
if he needs formula, that's what we'll do because we are both here and we are both alive.
And I feel like that is your body recovering from a major surgery takes a toll, and then it's like, okay, the milk goes on the back burner, so to speak. But I was the same way before. I was like, oh, however you want to feed your baby, I think that's amazing. Formula is great. And then when it came to me, I was like, oh my gosh, I'm such a failure. Like I wanted to do this. Like everyone else it's fine, but for me it's not fine.
Yeah, I still had that like emotion. Like obviously it whatever way you want to feed your baby, as long as your baby's fed, that is what's priority. But you still go through kind of like grieving that loss of like, I wanted to do it and my body wouldn't let me do it.
Yeah.
And that's really hard, especially after going through any kind of fertility or even, like, having an unplanned C-section, like, our bodies are designed to do this, why can't mine?
Yeah.
And so that kind of, like, rubbed that wound raw again a little bit. So, yeah, that it was a hard pill to swallow, but we did what we had to do.
Yep. And he is still eating and thriving, I'm sure.
Oh, he eats us out of house and home. He eats like a teenager already. Oh, boy, gross.
Oh my goodness. Well, I know you really went through so many ups and downs and battles that you did like fight tooth and nail for. So the moment of being able to have him, like you said, no matter how he was fed, no matter what's going, you're like, here, eat more now. Like whatever you want.
Yeah.
Did you have any struggles with either postpartum anxiety or depression? I know sometimes going through the traumatic type of birth and then obviously experiencing loss can kind of drum up a little bit of anxiety. How was that, your mental health after early postpartum?
Um, I was fortunate enough not to have a lot of postpartum depression, but I did have some postpartum anxiety. I definitely did lay awake at night watching the monitor, you know, and when he was in our room, going over and checking the bassinet, like, "Oh, is he breathing? Oh, yeah, he's fine. He twitched. We're good. We're good." And, like, going through the loss group, like, I know all too well you can make it to the finish line and not take a baby home, or take a baby home and lose that baby. And so I think that was kind of a con a little bit of the loss group, is I'm all too familiar with people that have lost a baby after making it. I call it the finish line, after getting to the finish line. So that definitely, I think, fueled my anxiety just a little bit. Um, we never used like an owlet or any of those crazy monitors because I thought that would give me more anxiety because that was just something I could sit on my phone and just watch. And I didn't think that was a good idea for my mental health. Some people it helps. I was like, I don't think that's gonna help me. I don't think it is. I think I just watch his little chest rise.
Yep.
And even now, if I wake up in the middle of the night, I'm like, is he breathing? Is he breathing? He's 15 months old. He's 16 months old.
And I think that'll last till he's probably 18. I feel like that once your mom, no.
I told my mom that once, and she's like, yeah, and you're gonna worry until you're gone. You're gonna worry forever, but
Yep.
that's your job. And so it's our job to worry. It's just a matter of being aware of that and knowing I'm a firm believer if you need help, get help. And so when I had a little anxiety, I did go to my doctor and said, this is what's going on. And she's like, yeah, that's not normal. And I was like, okay, so what do we do about it? And so I got back into therapy and got on an anxiety medication for a period of time. And I mean, I think it's normal to get up and check the monitor, but I was doing it a little excessively.
Yeah.
And so that with the support of my doctor, that helped a lot.
That's great, and I think that's a huge note of, like, know yourself and know if you are struggling, don't be afraid to ask for help because there is no shame, and you deserve to be whole mentally and functioning, so I absolutely agree.
Our babies need that. They need that. They don't need a mom that has stayed up all night watching them sleep. They need a mom who also slept while they slept.
Yep, agreed. Well, awesome, Carly. No, I think your story will be such a inspiration to moms that have either gone through loss or are currently dealing with that aftermath of loss or even just in their fertility journey with PCOS and whatever it may be. I really appreciate you being so open and vulnerable with the all of the details and sharing the story of your early loss and then your story with the twin girls, and I just really appreciate that openness from you.
Yeah, I've always been an open book about it. I think it's important. I think there's so much taboo around infant and pregnancy loss. for no real reason. Yes, it's sad. Yes, it's heartbreaking. But people are going through this pain every day, and they shouldn't have to do it alone. And so that's what motivates me to be open about it. I'll talk to anybody who wants to hear about it. Not many people do,
Yeah.
but I'm open to whoever wants to talk about it.
And I think that's a support because so many people I feel like do just kind of grin and bear it alone, but you don't have to because there are other moms who have gone out there. Other people will be there to support you. So know if you are going through something, there are communities out there that will absolutely have your back.
My mom makes fun of me because I'm a big fan of Facebook groups, but there's a Facebook group for it. And they will tell you what you want to hear. They will tell you what you don't want to hear. They'll tell you what you need to hear. Um, a lot of people say don't go to the internet for advice, but sometimes, every once in a while, if you find the right group of people, they'll tell you what you need to hear. And
Yeah.
a lot of, if you're going through loss and you're struggling to find those resources, try a Facebook group. Try a group. Uh, a lot of hospitals have resources for that, support groups and things like that. Like I said, we're lucky to have a group here in Omaha that does it for so many different kinds of loss. Um, but reach out to the people around you because chances are there's somebody in your friend group, there's somebody in your family, there's somebody in your church group, there's somebody somewhere that has experienced a loss in your life. And you're not alone.
And I think it's so common for once people share their story of loss, you'll hear someone else that you would have never thought, like, oh, yeah, I went through that too. And you would have never known because it is something, especially older generations, that was kept so close to the chest and never experienced. So talk to people, even if they haven't experienced loss, I guarantee majority of people are going to be there to support you.
Yes, exactly. And be prepared. It might open some floodgates. You might get some people that'll say, I had a loss 30 years ago and I've never told anybody. And that's hard to hear, but it's happened to me several times.
Wow. What would you say? Because I know, like you said, it's such a taboo topic of people that might not have personally experienced a loss, but they have a friend that is going through loss. I know sometimes people are just at a loss of what to say, or they don't want to bring it up because they don't want to hurt the person going through that. What is your advice to friends and family on how to best support someone they know going through loss?
I'd say you almost support them the way you would if they lost their parent or if they lost somebody else close to them. It is a little different with losing a child, but acknowledge the loss. Don't, it almost, for me personally, and it's not going to be the same for every single person, um, people that diminish the loss or pretend it didn't happen hurts worse. Miscarriage in particular is a very invisible loss. It's not this tangible object. It's not somebody anybody ever met and is no longer here. It's somebody that only I've met and only inside of me that got lost. Or when it came to the girls, there are 10 people, maybe, in our family and friend group that met the girls. 10 people total that ever met them. Um, you know, their cousins never got to meet them. A lot of their aunts and uncles never got to meet them. Um, so they're, again, an invisible loss. Nobody ever really met them. Um, but don't treat it as an invisible loss. That loss is very real, it's very present. Um, and ask them what you can do for them. If you're not comfortable doing that, food is my number one. Food. Feed them. Feed them, feed them, feed them. You know, when we went through the loss of the girls, the biggest thing was people brought food or people brought a group of friends I worked with got together and got almost a $500 gift card to the grocery store.
Oh, wow.
That was huge. That was one less thing that we had to think about. Um, we also, when we lost the girls, our house had flooded from the top down, so we had to move out of our house and then move back into our house, and then we lost the girls. My aunts came over and unpacked our entire house. Do I have any idea where anything is in my kitchen till this day? No, but it wasn't in boxes anymore, and that's what was important. Like, I wasn't living my life in shambles anymore. Um, it doesn't have to be a giant gesture. It can just be a little thing. Send a DoorDash gift card. Just be there to support them in whatever way that needs to be. I have a friend that's very uncomfortable with my loss. She's not really comfortable with children to begin with. Um, but shortly after our first transfer and miscarriage, her and her husband took us to dinner. And she didn't really say anything. She just invited us to dinner and they paid for the dinner. They didn't have to. And we went our separate ways. Nothing was ever said. And she texted me later and she was like, "Sorry I didn't say anything. I just don't know what to say, so we thought we'd take you to dinner." And that was fine. I
Yep.
was like, "You don't have to say anything." Like, I appreciate going out and not being treated like I'm broken.
Yeah.
Like, that was a huge thing,
Just a
not being
night of
treated
normalcy.
night of normalcy.
Yeah.
Like, it's fine that you're not comfortable with my loss. I'm not comfortable with my loss. We don't have to talk about it. I have friends I can talk about it with. But yeah, they took us to dinner. We didn't talk about it. We talked about normal things, work things, normal things, and they paid for dinner. We went our separate ways. And later she sent me that text, and I was like, "You don't have to talk about it. I just appreciate you not treating me like I was broken."
Yeah. That's huge. And I think the discussion of it being an invisible loss, don't treat it like an invisible loss. And like you said, each person is going to be different with how, if they do want to talk about it or if they don't, but just being there and not minimizing the situation and however they want to process it.
Yeah, exactly.
Yeah,
Exactly.
that's fantastic, Carly. Are there any other resources? I know you mentioned looking into Facebook groups. Do you want to share again the fertility doctor's name? And we can also link the fertility clinic below if anyone is looking to go there.
Yeah, so I go to Maud Doherty in Omaha. She's at Methodist Hospital. Um, she People give her a hard time. She's a little rough around the edges, but she knows what she's doing.
Hey, as long as the job gets done, we'll take it.
Yes. She treats me with respect and the job got done. So,
Fantastic. And then are there any other resources that either you use during pregnancy, going through the loss, postpartum with Granger, anything like that?
um, loss group is Collective for Hope in Omaha, Nebraska. They have groups for pet loss, anticipatory loss, suicide loss. There might be one for addiction loss. They've got resources for kids. They've got all kinds of different programs, even programs for families. It's free in Omaha. Um, there is an online portion to the infertility group. But if you go on, you can join us online. If you can't attend in person, they're fantastic. Like I said, that's free. It being free is a huge deal. I think the barrier of having to pay for things like that is really hard. Um, let's see. The Midwest Infertility Group, if you're in the Midwest, on Facebook, it's just Midwest Infertility, I think. They are great for other doctor recommendations, and just general questions.
Fantastic. Well, we will be sure to link all of those below as well so people can go check those out if they're interested. But again, Carly, I so appreciate your stories and sharing your birth stories with us, and we will see you on the next one.
Okay, sounds good. Thank you.
Thank you so much for spending part of your day with us. If you enjoyed this episode and want more stories just like this one, Please be sure to like and follow us wherever you listen to podcasts. Also, if you have a moment, please consider leaving us a positive review wherever you're listening to this show. These reviews are the best way for the algorithm to push out our show and get us in front of other plus-size moms who may be looking for a community like this one. Your kind words can help make sure that no one has to go through this journey alone. If you are a fellow plus-size mom and would be interested in sharing your story, please reach out to us at biggerthanbirthpodcast@gmail.com. Use the subject line, "Share my story," and I will be sure to get back to you as soon as possible. Want to put a face to a voice? Head over to any of our social media pages linked in the show notes below to see more photos of today's guest. Any resources or topics discussed in today's episodes will also be linked below. Thanks again for being a part of the Bigger Than Birth community, and we will see you next week. Bye!